for this day and age, a lot of time, when the mom is pregnant, still needs to work, which is good. However, we need to know that maybe it's the time to cut back a little bit or not to stress yourself out, especially if we're a career, like we're so focused on a career before we get pregnant. Having a healthy baby is not just about the baby, and it's not just about the mother. It's actually the unification of mother and child. So the mother's health is going to affect the child, and the child's health is going to feed back to the mom. If we want to think about the healthy pregnancy, we need to think about what is the best for the mom and the child at the same time. So for instance, for this day and age, a lot of time, when the mom is pregnant, still needs to work, which is good. However, we need to know that maybe it's the time to cut back a little bit or not to stress yourself out, especially like we're so focused on a career before we get pregnant. And that take it as a time that we want to set the foundation for the baby. Because a lot of time when the mother is stressed, there's a lot of inflammation going on in the mother, and that can pass through the blood placenta barrier to the child. And that set a volatile foundation for the child to receive so much inflammation. Again, for the healthy pregnancy, it's never gonna be far from the basic. How do we rest or sleep? How do we eat? And how do we move? In this day and age, a lot of times it's that we are going to the extreme spectrum. Either we eat too much or we are not eating enough. What I mean by eating too much is that we can over season, over salty, over sugar, too much oil, or too much processed food. Of course, natural fruit, fresh fruit and vegetable is always the way to go, but you want to incorporate as much as you can in your diet. And of course, we don't want too much salt, we don't want too much sugar, we don't want to have too much protein or fat, everything in balance. But of course, you're going to ask me, like, how do I know if it's balanced? Well, if you don't want to stress yourself out in eating, then incorporate as many different kind of food. A little bit of every color will be the route to go. So if you don't know what is in balance for you, look at if you have good digestion or a good bowel movement. Do you feel satisfied after eating instead of having cravings? Do you feel satiated? And do you feel energetic after eating instead of feeling sluggish? So these are the signs that you can kind of come back to yourself and ask yourself this question. And that's how we be mindful about what we eat. And how about sleep? So we all know our body restore when we sleep. The restoration also benefit the child in the womb as well. So let's say if we just keep go and not resting, not sleeping enough, then we're not helping the child to restore as well. So setting a foundation for yourself and for the child is very important. And how about movement? Again, we are seeing more of that extreme, either not moving or moving too much. So when the mother is someone that is not keen to move a lot, then maybe this time it's good to build a healthy habit of movement. Maybe take walks, maybe light hiking, or maybe a light cardio will also be good. But what about moving too much? Like we still want to keep the movement schedule, workout schedule the week before pregnancy. Well, some people might be okay, but for some people that's not. Depending on the lifestyle, depending on the stress factor. So one of the good indicator is that are you able to sleep soundly at night? So sometimes when we work out too much, we'll have trouble falling asleep or staying asleep. And for pregnant mom, that's also a good indicator. Are you sleeping enough? Are you having good quality of sleep? That's also very important. If someone likes to work out, good, you can keep working out, but always come back and look at our sleep quality. Is it good enough? Am I feeling restored? Am I feeling energetic? Am I ready to go in the morning? If you like this video, please subscribe and follow me, and I'll see you soon.